Do this before getting your veneers done. I get a lot of patients that want to get their teeth done, but at times they just don't know the overall health of their teeth. So a cosmetic dentist has to also ensure that the patient is healthy enough to get the veneers done. So for example, I'm gonna review this couple of cases that we have seen in our office where patient just didn't even know that there are some general health issues that the patient needs to make sure that clears prior to doing the cosmetic work. So if you haven't been to a dentist in a while, you definitely want to go visit a dentist. Make sure that you are ready in terms of overall health is restored. If you have gum irritation, if you have really deep pockets, basically bone loss around those teeth, and you have active bleeding there, you definitely want to make sure that those things are healed up nicely prior to putting veneers on. If you just did braces and you have gummy smile and it's very puffy, that's another thing that we want to make sure that we address prior to putting the veneers on. So we may have to reshape your gums and then wait long enough for the gums to heal up and then start the veneer process. If you already have veneers or crowns or bridges and you are ready to redo your smile and get this new beautiful transformation, what are the things that you need to do before you go and get the new smile done? In my office, I really want to take my patient's CBCT, basically a CT scan of their teeth. A lot of times a patient doesn't even know that there's a tooth infection when we see the patient from another office where they just take regular x-rays. So if a tooth has a previous root canal done, or if a tooth has a crown there or a big filling, maybe the scan might show certain things that a regular x-ray won't show. So a CBCT scan is really important on revision cases prior to doing veneers to just make sure that all of our teeth are not just looking healthy, but also healthy at the gum level and at the root level. So if irritation is there at the gum level, say bleeding for example, or just a lot of tartar and a lot of calculus buildup, definitely those things need to be cleaned out. If there's anything going on with your old root canals, if a root canal is not hurting, but the CT scan shows that there might be some bone loss around that root, maybe it needs to be reevaluated. Maybe the root canal needs to be redone prior to putting a new crown or a new veneer on. So these are things that is important, and I would always tell our patients to ensure that they take their time. I know flying and getting your teeth done in one visit is obviously a very comfortable thing to do, but at times if you have this kind of issues, if you have gum irritation, if you have say haven't been to a dentist in a while, like maybe you want to do those things first prior to getting your one visit set up with the office to get your cosmetic done. So here are some examples. Like here's the patient where he doesn't even know there's something wrong with his teeth. He's already excited. He's ready to do his upper and lower teeth. When I saw him in the office, I saw that he has so much bone loss, like almost throughout his front teeth. He has severe bone loss. So we treated his gums. He also had a gummy smile. So we wanted to take care of his gummy smile. We're going to take care of those bacteria that's causing the bone loss. We put him on antibiotic mouthwash. We did a laser debridement, clean out those gums as nice as we can. The front teeth were not healthy enough. I just didn't want to restore those and take a chance of them failing sooner than later. So we did take those two teeth out in the front just to ensure that he gets a smile that's going to last him a long time. But gum health was restored first, waited almost 3 to 4 weeks. I believe it was over a month on this specific case. And after that, he started the veneer process. Here's a second example. This is a revision case where you have a lot of these crowns done at different times. I know the patient mentioned that she feels sensitivity here and there. That should not be the case. If you have nice restorations on your teeth, say veneers or crowns, your teeth should not be sensitive. I want you to be able to enjoy all your food. So in this specific case, I wanted to ensure that their teeth are healthy enough before we go ahead and replace them. So unfortunately, we had to do a couple root canals here to get the patient out of that sensitivity zone and get her back to a normal state. So we cleaned out all of the root surfaces for her. did the root canals on one visit, and then we did her temporaries and then the finals. And here you can see before and after how the gums look so nice around those veneers. She also had a little gummy smile, so we reshaped her gums. So these are things that's important. I believe that, you know, it's not just about cosmetic appearance, but it's also about how healthy it feels and how healthy it is in the mouth, where it can help us just feel normal. A lot of patients complain about, you know, not in our office, but about possibly having a bad breath with crowns and bridges or veneers, and maybe they rushed into getting the veneers done, and maybe there were some gum health issues that were still pending, maybe there were some cavities that were still pending. These are things that you really want to make sure that gets addressed prior to doing your veneers.